I've come here many times to talk with students, parents, and educators about the tough issues of the day, from gun violence to cyberbullying. Now I'm back again to discuss an issue in the minds of many families today, and that's vaping. We've all seen the news, and it's scary stuff. More than 380 people in 36 states have been hospitalized for illness linked to vaping, including 3 confirmed and 19 suspected cases in New Jersey the last time I checked. Nationwide, 6 people have died. Many of these patients are young and otherwise healthy people who suddenly found themselves struggling to breathe. In Illinois, one doctor said that his 18-year-old patient's lungs look more like a 70-year-old than that of a teenager. And the New England Journal of Medicine issued a call to physicians across America to discourage their patients from vaping. As health officials nationwide work to find the root cause of these illnesses, one of the challenges they face is that no one single vaping product has been identified as the predominant risk factor. Some patients were reportedly vaping e-cigarettes. Others were reportedly vaping aftermarket cartridges with THC extracted from marijuana, along with chemical additives like vitamin E acetate. Some patients were vaping both. But let me be clear, this vaping problem didn't start overnight and it will not disappear tomorrow. According to the FDA, vaping among teens has skyrocketed by 78% just in the past few years. The numbers are shocking, but they shouldn't be surprising. It took the United States decades of effort, boatloads of money, years of awareness campaigns, and scores of regulations to tackle teen cigarette use. And guess what? It worked. In 1996, about 20% of all 10th graders reported smoking combustible cigarettes every day. By 2015, daily smoking among high school sophomores had dropped to about 3%. In my view, we didn't spend all of this money on research, education, and prevention just to let companies like Juul waltz in and get an entire new generation hooked on nicotine. That's what's happened here. These vaping products come on the market with no regulation, no research, and no restraints on their marketing to our children. Not to mention the Trump administration's initially delayed enforcing the FDA's authority over e-cigarette products until 2022. Now e-cigarettes are widely available and millions of teens are getting hooked. We've seen companies like Juul and Blue debut fun colors and flavors like green apple and strawberry lemonade, along with splashy advertising campaigns featuring young people having a blast with every puff. Across the nation, some schools even let Juul come and give assemblies, for God's sakes, all about how much safer their products are compared to traditional cigarettes. While the health risks may be different, what we've learned from these products is that they are anything but safe. In fact, the nicotine in these e-cigarettes can sometimes be twice as much as found in a traditional cigarette, making teens even more vulnerable to addiction. Late last week, the president announced the FDA would begin exploring a ban-flavored vaping products. I support that action, but I also know it will take months before new regulations will take effect. I also commend Governor Murphy for launching a state task force to respond to the public health threat, as well as Attorney General Grewal for investigating 15 e-cigarette companies, including Juul. These are steps in the right direction, but with more people getting sick every day, we need bold and immediate action. That's why today I'm calling for 5 more steps to get this crisis under control before it claims even more lives and even more young people get addicted to nicotine. First and foremost, we need a moratorium on the sale of vaping products until the experts figure out exactly what's going on. Many of these vaping pods, cartridges, and liquids include additives and substances beyond nicotine, or in the case of marijuana users, THC. The bottom line is that we don't yet know exactly what's destroying the lungs of these vapor users. So for retailers, The smart thing to do is immediately stop selling those products. For teens, the smart thing to do is to stop using them. And for people of all ages who are grappling with the symptoms of nicotine addiction and withdrawal, I urge you to talk to your doctors. They can help you. Our second priority is to end deceptive marketing to our kids. The fruity flavors, the catchy colors, the promoted tweets and Instagram ads, these false claims that vaping is safe. Enough is enough. We know that Juul is already under investigation by the Federal Trade Commission for their deceptive advertising, but we need every company engaging in these tactics to be held accountable. That's why I've joined several Senate colleagues calling on the Food and Drug Administration to ban vaping ads aimed at our youth and require mandatory age verification for every e-cigarette sale. Step number 3, we have to shut down online loopholes. In New Jersey, it's illegal to sell tobacco products, including e-cigarettes, to anyone under 21. But what kids can't get from the corner store, they can easily get online. And too many of these black market items contain a mystery elixir of chemicals. That's why I've joined Senator Blumenthal of Connecticut to write several online retailers and call on them to get these potentially toxic products off their virtual shelves. Whether it's eBay or Alibaba or anyone else, no company should want these deaths linked back to their sites. It's the responsible thing to do. Which brings me to step 4. I've co-sponsored a bill called the PROTECT Act, which stands for Preventing Opportunities for Teen E-Cigarette and Tobacco Addiction. Congress should pass it without delay. This legislation will provide the CDC with $500 million over the next 5 years to combat teen vaping. This money will go to research on the health risks posed to our children by e-cigarettes, the links between vaping and smoking, the threat of nicotine addiction, and more. It also calls for a CDC campaign to educate parents and students on the health risks posed by vaping. These e-cigarette companies want you to believe their products are less addictive than traditional tobacco products. They're lying, just like big tobacco ancestors lied. That's why the 5th step we must take is to start taxing e-cigarettes the same way we do as traditional cigarettes. As a member of the Senate Finance Committee, I have co-sponsored legislation to do just that. The evidence has shown that taxes on harmful tobacco products are one of the most effective ways to reduce usage, save on healthcare costs, and deter teens from buying them. So look, in the face of a real public health emergency, it's incumbent on all of us to raise awareness and warn people of the potential risks of vaping. We need answers and we need action. The truth is, we don't know if it's a single substance being vaped or a cocktail of chemicals being vaped that's making Americans sick. What we do know is that taking another puff from your vape pen isn't worth the risk of winding up on a ventilator. It's time to press pause, to find answers, and above all, to protect our children.